Hello, everyone, and welcome. Thank you for joining our monthly Hunger, Nutrition, and Health Action Collaborative webinar. I'm Rachel Forensic with the CDC Foundation. I want to give you a few housekeeping reminders. The Zoom chat is open, and we invite you to introduce yourself and the name of your organization. During the panel discussion, we will then close the Zoom chat, but then we'll open it up back towards the end. In response to feedback from you all, we have changed our webinar format. So we are now an hour long every other month. We are having much longer, richer conversations because of this new format, and we welcome your feedback on how that works for you. As I mentioned, the chat will be closed during the panel presentation and their Q&A conversation, but then at the end, it'll be opened. If you have questions that you want to ask the panelists, please put those in the Q&A. Don't usually need to remind folks because you do this so well, but just a quick reminder to please not post any political commentary or sell any products. We're happy for you all to tell people about resources or events, websites, but we appreciate leaving the other things out. Again, please submit any questions in the Q&A, and we will do our best to get to those. We've already received a number in advance that we're looking forward to. And as always, we will share a recording of today's session by email, and you can also view it at our website, impacthunger.org. So let's, Lexi, if you would please open up the poll. We always like to know who has joined us today. We'll give you just about 15 to 20 seconds. All right, we can probably close that now. Great. We always have a great showing of community, neighborhood, national nonprofits, but we also have some corporations, philanthropy, academia, health system, state and local government, and glad to have you all here today. I'll close that out. And now it's my pleasure to hand the meeting over to my colleague, Diane Kolak, who is going to introduce the panel and get started. Diane, it's all you.
Hi, everyone. Thank you for joining us today. We're really glad to be covering this topic. It's so important. Nearly 2 million people are incarcerated in the United States right now. From a population health perspective, the question isn't whether they're being fed. The question is whether that food is actually supporting health, dignity, and life after release. And the evidence tells us it is not. Research shows prison diets are high in sugar, salt, and ultra-processed foods, the exact foods we know drive chronic disease. And because 95% of incarcerated people eventually return home, that harm doesn't stay behind bars. It follows people back into their families, their communities, and our shared healthcare systems. For pregnant people, the stakes are even higher. No federal law requires prisons or jails to meet prenatal nutrition standards. That gap has real consequences for mothers, for babies, and for health equity. This is not just a corrections issue. It's a maternal health issue and a public health issue, and it's long overdue for the attention of leaders like you on this call today. Food in prison is one of the most widespread and under-examined public health crises in this country, and today we're going to talk about it openly. The good news is that we're not the only ones. In February, the TV show The Pit featured an episode on prison hunger and malnutrition. And today we have with us the author of the recently published book, Eating Behind Bars, Aishatu Yusuf, joining us and others on a fantastic panel. So we're going to get started.
Hi, everybody.
Yep. Aishatu has more than a decade of experience developing innovative solutions to complex social problems. At Impact Justice, she has helped create and sustain transformative projects, including California Justice Leaders, the Homecoming Project, and the Food in Prison Project. Aishatu has presented nationwide, provided legislative testimony, drafted education policy, and is regarded as an expert voice on this topic in the media. We're also joined by Heile Gantan-Keo, a program manager with the Food in Prison Project at Impact Justice. Her background in nutrition, public policy, and lived experience with the California Department of Corrections and Rehabilitation drives her work to improve essential resources in jails and prisons. And we are joined by Ryan Souza, an attorney, lobbyist, and consultant based in Sacramento with deep experience in health and human services, criminal justice, and labor and employment. Drawing on more than a decade of work for the California Department of Corrections and Rehabilitation, Ryan's firm has supported Impact Justice on its initiatives with California prisons. And last but not least, we're joined by Krista Lumpkins-Howard, a respected maternal health advocate and community leader, serving as Senior Director of Training and Community Impact at Birthing Beautiful Communities, a Cleveland-based nonprofit working to reduce infant and maternal mortality. With more than 27 years of experience as a full-spectrum doula, community health worker, and childbirth educator, Krista is committed to improving outcomes for Black and Brown birthing people through culturally competent support across pregnancy, birth, and postpartum. Her work centers on advocacy, equity, and training responsive doulas. So with this amazing panel, we are ready to get started. My first question is for you, Aishatu. Tell us about your work at Impact Justice and your book, Eating Behind Bars, and what drew you to this topic.
Yeah, I'm so excited to be here. So thank you for inviting us at Impact Justice. As Diane mentioned, I'm the Vice President of Innovation Programs at Impact Justice, which means we're an organization that sits at the intersection of innovation and criminal justice. Two words you often don't hear together at the same time. But as an organization, what we wanted to do is have a conversation about how can we ideate to scale new ideas with partners that see themselves as likely and unlikely partners in the criminal justice space. We do a lot of things at Impact Justice. Some of them are on housing, some of them are on food, some of them on workforce development. The reason I'm in this conversation is when I work on our Food in Prison project. About 6 years ago, about 6.5 years ago or so, we're having conversations on food and a lot of other spaces in this nation. And the conversation came to be, well, what is happening around food inside of carceral facilities? And we started to do some digging to figure out what that was. The truth is that the conversation on food or the harm that food causes for people that were inside and their families is not a new conversation. However, that conversation to the broader public, to policymakers, to thought leaders, to funders, to advocates, that was a newer conversation. We wanted to bring what the people inside were feeling and experiencing to the broader public. So about 5.5 years ago, we wrote the report called Eating Behind Bars. It ended up being a six-part series. A six-part series that brought to light what people inside were both experiencing, the impact on their mental health, their physical health, but also one of the things we really facilitate and have a conversation about is really about what change can be and what change has happened. So what brought us to this conversation is because we're an innovation shop. We wanted to talk about the things that people weren't talking about, but more importantly, we want to find solutions. So our report then became a book that we just released last October, and that book really focuses on solutions. We see ourselves as an organization that does things. How do we take narrative change? How do we take information, data, and research and create programming? So because of that, we've created a lot of programming, some that my colleague will talk about, but also others. And really the conversation is how do we change the narrative on food in prison? How do we bring in prison administration? How do we bring in policymakers and those most impacted to be able to have a conversation about what change can look like and how do we do that collectively?
Thank you. That was a lightning round of wonderful information, and I really appreciate you sharing that with us. You mentioned there are a couple of different initiatives. Can you describe the Food in Prison project for us?
Absolutely. So the Food in Prison Project is a big umbrella project that we have at Impact Justice. The goal of Food in Prison Project is both about narrative shift to bring the conversation of the experience of food behind bars to the broader public, to tell the individuals that are inside we hear what they're saying, and to actually bring conversation and collaboration with the actual prison administration, policymakers, and those that can change the system. Because our Food in Prison project is both narrative shift and program development, we develop a lot of projects inside of there. So we've developed projects called our Harvest of the Month project, which is literally bringing fresh food inside of the prison. We develop projects, our Growing Justice project, which we'll talk about later, that's also bringing fresh food in the prison, but also workforce development. A big piece of what Food in Prison is trying to do is not just change the narrative, but change the way people in prison actually eat. What it is, how do we change the narrative of what people understand they deserve, and how do we have a conversation about using food as punishment in our prisons? The individuals that are incarcerated, right? Food and their required amount of food and what they eat is not part of their punishment. It is not part of their sentence. And so how do we bring that conversation to the light to both express and talk about their experience while also creating solutions at the same time? So the Food in Prison project is a narrative shift project. It's a project that builds and develops, ideates to scale projects that can change the system, and most importantly, change the system that can impact the people inside, which then impacts the rest of our society, because 98% of people that are inside are exiting. They exit back into our communities. They exit back into, our grocery stores, into our hospitals, into anything that we do in society. And so if we're not thinking about what's happening on the inside, then we're failing them when they come onto the outside.
Thank you. This is such important work. And we're going to hear about another project at Impact Justice with Heile. Heile is a program manager at Impact Justice, as I mentioned. Folks on this webinar come from nonprofits, government, academia, as we saw in the poll, and really have a vested interest in food and nutrition security. Heile, can you tell us what are the most serious nutrition gaps for people who are incarcerated in the U.S.?
Yeah, thanks, Diane. It's interesting because a lot of times we talk about those who are closest to the problem are actually farthest from the solution. Through Food in Prison and through the work that Impact Justice has allowed us to do, I'm very fortunate to be able to bring lived experience to the work, helping really manage the programs that we see under Food in Prison. And so where I come from in answering this question, I think it's bigger than just nutrition, but really talking about the gaps as it relates to food and the food environment inside of these carceral facilities. Things that we've heard about, I've heard about directly from women in response to my own experience. And even when we had the report come out, we did an investigation across the country and spoke with formerly incarcerated folks, system impacted folks, so really like the loved ones of people who are currently incarcerated. And we heard similar patterns where nearly in our responses, 60% of folks reported not having or rarely ever having access to fresh vegetables. And almost half of those respondents also reported that they never had access to fresh fruit. And so this is really problematic, right? Not just really about the nutrition sense, but when there's such a big push for wholesome, fresh, healthy food, at least here in the public health setting, there is just this extreme dissonance with the food that's actually being served to folks who are on the inside. Other really serious nutrition gaps, as it stands in carceral settings, is that there is a standardized menu. And when it's standardized, that really becomes problematic because it doesn't account for body composition. It doesn't account for sex. It doesn't account for the different life stages that people are in. We have such a huge, unfortunately, a huge aging population that is currently incarcerated, who have been incarcerated for 10, 20, 30 years. Many of them who are, approaching kind of end of life stages, their caloric needs are not the same as, a growing person. I know we'll get into this later in our discussion, but, thinking about the pregnant, like early postpartum population too, there are very different needs that unfortunately are not able to be catered to. For many reasons, because of budget, policy, limitations, that even if the population is really trying to uplift and amplify to those who are in power, there's just so much red tape, and also like a lot of internal policies that would prevent them from making really actionable and meaningful change. Other things that we talk about too, and we learn about from the population themselves, is that after many years of incarceration, after eating a diet that is very low in micronutrients, very high in sodium, very high in sugar and starchy carbohydrates, a lot of them have things like kidney disease, diabetes, these very chronic illnesses that unfortunately, they're not given additional foods or foods that would restore their health. Instead, a lot of the time, medical practitioners are just guiding them to omit, eating certain things that are on the tray. How this continues to be even more problematic is that then if you're telling folks to avoid eating bread on the tray, they're left hungry. They're left with less fiber because there is some fiber in bread. But if you're really focused on, trying to work and eat around your diabetes, there's just this tug of war between what they should eat, what they shouldn't eat, short term versus long term, health impacts. So it's just a very intricate system where it's hard to just try and fix one thing without having other unforeseen consequences when it comes to people's intake inside.
Thanks for giving us that insight into nutrition specifically. And I know you're trying to change things from the inside out, and that's where the Harvest of the Month project came about. Can you tell us a little bit about the Harvest of the Month project and what maybe food and beyond food, what you're trying to solve for with that work?
Absolutely. Thank you. So our Harvest of the Month program is not something that we created on our own. This is a well-modeled, shown to be very successful in K through 12 settings. And for those who are on the call and may not be familiar with the Harvest of the Month program, this was a program designed to increase variety that is being consumed initially by school-age children in K through 12 settings, but also other stakeholders that are involved in this program include small, medium farmers for the most part, or local farmers, local producers, as a way to really strengthen the local economy and the local food supply chain while supporting the health and food access for young eaters. So the way that we were able to introduce Harvest of the Month here in California to the California Department of Corrections and Rehabilitation was through a bill that was passed in 2022, which went above and beyond any other local procurement bill that we have seen, because this actually had some teeth to it. We've seen some price preference policies where as long as it's no more than 3% from your local vendor, that contract can be awarded. But with this bill, which is called AB 778, passed in 2022, this requires state-run institutions to purchase a minimum of 60% of their agricultural products from California growers and producers. 60% is a large number, but I think that there was a lot of faith and confidence here in California because California is just known to be such a huge agricultural state. So when we learned about this bill being passed, we had already been talking to CDCR and trying to get them to produce more local foods, trying to get them to serve better quality fruits and vegetables to the population, knowing the research that we've conducted. And it wasn't until this bill that they were like, okay, yeah, we have to do something in order to be in compliance with it. So we introduced to them the Harvest of the Month program. It was a very small, bite-sized, way to start introducing local items to the population. And we scaled out very small. We started at 3 facilities, added 3 additional facilities every quarter until we reached all 30 participating facilities by October of 2025. If you know anything about working with a correctional department, it is often extremely difficult to get through that red tape that I was alluding to earlier. But we are just so happy that nearly 90% or 90,000 residents that are currently under CDCR's care, for lack of better terms, that they're able to participate in this program. Other impacts from this was about 24 small and medium farmers are able to join in this program, really creating a sustainable market channel for them. The ag industry has really been hit for many socio-political reasons, especially in the past year and year and a half. So they're really looking at this as a sort of lifeline for them. And then the third avenue in which we're showing more benefit to this is, again, the agency is able to really comply with policy. a way that this goes kind of above and beyond the bill language is that we are working with farmers that utilize organic practices, regenerative farming practices. And so this is not necessarily a requirement, neither is sourcing from small and medium farms. But this is something that is attractive to the department as something that they can say they're doing out of good, corporate social responsibility as well.
Well, thank you for sharing that with us. It is really wonderful to hear a project that is making a difference for, did you say 90,000 people?
Yep, that's correct.
That's huge. Thank you. So as Aishatu and Heile mentioned, there is so much red tape to get any kind of project going with a government agency, much less a corrections department. So through this webinar, as you know, if you've joined us before, we like to focus on partnerships. And we have Ryan, who is an attorney, lobbyist, and consultant who worked with Impact Justice on getting some of these programs into prisons in California. So Ryan, we're going to turn to you now. What were some of the main obstacles in getting new programming inside prisons?
Thank you. I'm glad to be here, everybody. Yeah, I think, the two things I would actually say go back and just rewatch what Hyla said, and the way that they approach things is really the ideal path sometimes to get things moving in correctional facilities. But the two things that come to top of mind with this question are institutional culture, and the easiest answer is always the status quo. And how do we overcome those two items, right? So when we're talking about culture, it was trying to find ways to get people to understand that that culture can be changed and get buy-in, both from the institutional population, the custody population, the executives. Everybody really has to be on board with this. And so finding those trusted messengers, I would say, is a big target. Everyone can see I am a white male, and so I cannot represent every piece of the population and every aspect of it. So really finding people that with lived experience, people with custody experience, people that have gone through and been a part of the system is really, really critical. And I think, understanding that those messengers and getting their support for it has really just, I think, moved rehabilitation in a different path when we're trying to do those things. The second thing is really trying to help them. How can I make their life as easy as possible? Even though I'm internal in the department, it's like, if I can write a policy for you, we're going to do it. If we can collect data for you, we're going to do it. And I think that is actually one of the real successes that Impact Justice sees, is they're willing to step up to the plate and help and say, we're going to walk this path with you. We're going to help guide you with this path. And those are really two of the things that I think really make a difference in actually getting programming started and keeping it moving with a sustainability in mind. The only thing I wanted to add is really overcoming obstacles, just reinforcing really being a champion of what is needed. If, a lot of times you'll go into custody environments and it's overtime escorts. Perfect. I'm going to go to the legislature or to our budget administration and champion that you're going to get additional overtime funding. Okay, you're having an issue with technology. Let's find some technology support to help you make sure that you're able to capture the needs that are going on here. And so really trying to get them to overcome all of the obstacles that are inherently going to come up, the red tape that everyone hears about. I used to say in my position, and I say it still to this day, okay, tell me what the obstacle is, because if it's a policy, that's great. That's just a drafting of a policy and signing it off. Okay, it's a regulation, that's 90 to 120 days. Let's rewrite regulations. It's a state law change. You just heard it from Hyla. Let's get some laws changed. Like, there's nothing stopping people from making a better and more holistic institutional experience that's healthier for everybody. It's really just getting past what is, I think, the historical bureaucracy of, we've already got the system in place and it doesn't need to change, it's too big, and continuing to push on that.
Thanks, Ryan. I'm really struck by what you shared, and it sounds like your overarching strategy is to invite people to be part of the solution. Like, let's figure out why this is hard, and then let's get whatever that nitty-gritty thing is, let's get that out of the way. So it's great to hear that. Now we're going to turn to Krista. Krista is a doula in Cleveland, Ohio. And Krista, since you work directly with incarcerated people who are pregnant and not pregnant, I'd like to understand, why is pregnancy such an important lens for this conversation? And what does doula support actually look like for someone who's pregnant and incarcerated?
Absolutely, Diane. So thank you for allowing me to be a part of this conversation. So I would like everyone to imagine navigating pregnancy in a setting where your movements are controlled. You don't have access to care. Your voice is often dismissed, and your support system has been completely removed from you when you need them most. So at this point, pregnancy becomes more than just a health event. This is a health crisis, right? So here in Cleveland, Ohio, we have a program called Birthing Moms Unchained. So we partner with the correctional facilities as well as one of the hospitals and the City of Cleveland Health Department. What do? We offer doula support for every birthing person who is incarcerated. So this all kind of evolved a little bit because we were trying to sneak in mandarin oranges and apples and bananas into the jail, right? Because our birthing persons, they just wanted a piece of fruit. So we consistently were like, hey, we got to make this happen. So we make sure that all of our birthing people they are not chained. They do not have a guard in when they have their babies. And our doula is there the entire process. We go in twice a week. We offer centering classes, and then we do childbirth education classes with them. We also support and have conversations so they feel heard, they feel supported, and they don't feel alone while they are in there. Then on the other side, we often support the families. So whoever gets that beautiful bundle of joy, we make sure we have classes with them, we support them. And then we even had an incarcerated person, she was able to breast pump for over a year. She filled the freezer up, and then one of our doulas actually took the milk to the family every single week. So it was super cool to see that she was able to do that while still being incarcerated. So we recognize that our doula support is both important and how we are making changes in the systems by going in there every single week.
Thanks, Krista. And I don't know if you see the stuff in the chat and some of the little cartoon emojis, but I can tell that our audience really appreciates that as well. Aishatu, your Growing Justice program addresses some of the conditions that Krista was just talking about and more. Can you tell us a little bit about your programs and partnerships that you have in California and in other states?
Absolutely. First, I just want to give just a huge shout out to the work that Krista is doing. Having breast pumping for an entire year for an incarcerated person's child, that is an amazing feat. So congratulations on that. That's so amazing. So, because we're an organization that does things and thinks about solutions, we built a number of projects, some that Heile spoke about, but we also have a project called the Growing Justice Project. We think about the conversation of food in prison. What we're often talking about is the fact that people in prison do not have access. They do not have choice. They do not have access to fresh, healthy food. And prisons will often cite cost and all kinds of policies and procedures, as Ryan mentioned. But if you really want to think about prisons, there's no greater place that experienced food apartheid than a prison. And we wanted to change that. We wanted to work with the prison and other partners to change that conversation. And so we wanted to actually do that in two distinct ways. We consider a lot of our projects as dual impact. And this is another one of those. We wanted to do one thing, which was to get healthy, fresh food inside of a prison. We want to do another thing that prisons often need is workforce development options for individuals. So we decided to combine those efforts. So because we know that prisons are all across this country, and we know that the weather and the soil is different all across this country, we wanted to use technology. We wanted to use another way to think about getting food inside of the prison. We did that by our Growing Justice Project, which uses climate-sensitive approaches to farming. We're putting containerized farms inside of prisons. We're starting in South Carolina and in California, putting containerized farms inside of prisons, which means they are weather agnostic, which means they can be in any place at any time growing green leafy vegetables for the people in prison. So we particularly started with women's facilities, and we started with women's facilities because I don't know how many folks on this call do a lot of work inside of prisons, but what you often know is that women's facilities are the last to receive resources, the last to receive support, and we wanted to start with them first. Not only because they are deserving of that, because we wanted to prove our model works where individuals do not often invest. And we can prove our model works where individuals do not often invest, which means our model can work everywhere. So we partnered with the South Carolina Department of Corrections and the California Department of Corrections Rehabilitation, put a vertical farm currently in South Carolina's Camille Graham Prison. We have an entire curriculum that we teach the women inside of the prison how to grow, to learn hydroponics and learn hydroponics and actually learn how to grow the food inside of the containerized farm. And the best part about this is that they get to eat the food, not just the women working on it, but the entire women's prison get to eat the food. I have had the butter lettuce that they have grown, and it is chef's kiss. It is delicious. The women inside now have access to the green leafy vegetables that are grown inside of that farm. Let's say what they get is salad bar a week, is how we like to call it. And the women that are growing that food now have a whole entire subset of skills that they can take on the outside. A couple really important things about this project. You know, I'm on this call. We are all right. It is. And right now I'm in the West Coast, so it's 1 o'clock my time. I'm at work right now. You are all at work right now. So why would it be that the women in prison that are growing the food would be working and not being paid for it? We didn't want that to be the case. So we actually partnered with organizations, one in South Carolina called Power Ed, to actually help pay the women inside of the facilities to actually grow the food. So both of our projects in California and South Carolina, the women working in our vertical farms will get paid at least minimum wage to work inside of that farm during that cohort time. They also get to eat the food, they grow the food. And then we have a workforce development arm. Currently in South Carolina, we've graduated our first class. We have a team on board that is actually helping facilitate workforce development, helping them land jobs, not just in farming, but jobs that are involved with the food system entirely. We know that everywhere there is not a vertical farm, but vertical farms are not everywhere across the country. So how do we take those skills and apply them? So we have a workforce development team that works with the women to be able to do that. We are only successful in this work, as Ryan said, and as Heile said earlier, because of the partnerships that we create. So we, as a nonprofit organization, work with the prison to do this. We work with organizations like Scout Strategy. You know, before this project, I was not an expert in containerized farming. So we brought on the partners that could help us do that. Amplify Ag that helped us do this. Agritexture that helped us do this. And foundations like Power Ed, the federal government, other philanthropic organizations that help us build out this work. And the beauty of this project, as I mentioned, we've already graduated our first cohort, but we are hearing stories of the women eating the food. I had a story the other day talking to our South Carolina team, and it used to be that chicken sandwich day was the best day of the week. Now there's a fight for salad bar night. The women were hungry legitimately and also hungry for fresh food. And we were able to do that by not just getting them fresh food, but having them be a part of the process. So I'm so excited about this project that we built. And the beauty about growing justice and vertical farms is that they can be anywhere. Whether we go to Idaho or Massachusetts, South Carolina, or in California, we can grow this project anywhere. The last thing I'll say about it is we've done it. We're growing this project so big. Our office is in Oakland, California. We've actually knocked out some walls in our own office to put a vertical farm in that space. We are teaching individuals that are formerly incarcerated and system impacted to work in our farm and our organization to ensure communities around us that are deserving and our communities that also need fresh food can take the food that we're growing inside and give it to them as well. So we're so excited both about what we've done and the progress and the progression of this project.
Oh, that's amazing on so many levels. Thank you for sharing with us about that project. Is called Growing Justice. And for everybody who's on the webinar now, as you know, we'll send out a recording, but we'll also send out links to the different organizations' websites. And so you can get inspired and hopefully grow this work wherever you are across the country. And before I go to the next question, I also want to let everybody know if you have questions, put them in the Q&A feature at the bottom of your screen on Zoom, and we will take audience questions in about 5 minutes or so. So Heile, I'm going to turn back to you. From your perspective, you've worked in policy, nutrition, you have lived experience. Where do you see the strongest opportunities for reform?
Strongest opportunities, I would say, based on the experience with how Harvest of the Month has come to be, is really around policy. Attacking this from the top down, but again, having that policy be informed by the voices of the people that are affected the most really is key, because when we have folks who are high at the top, there's a lot that is overlooked. Even with the current bill, as great as it is compared to previous bills that have been passed and put into legislation, there is still a very key missing component to the current legislation. And really, that is measures of reporting, because there is no real record of how the department is spending down. Even when funds are granted, if there is, a proposal for additional funding to support the new bill, oftentimes there's no record of how it's being spent. And so where that leaves a huge gap is in terms of accountability, right? Like, how is the agency really utilizing those funds in a responsible way? How are they exercising the use of those funds to make sure that what it was allotted for is actually being used for its intended purposes? And so, there is no perfect policy. I think that a lot of times as advocates, it's really easy to rally and really go for, the everything that we want, the best case scenario, but also being very realistic that it does take some incremental change to make our way towards the reform that we want to see. I also am a firm believer in the community coming together and really just continuing to share the stories, right? Uplift those stories that are so important, centering the voices. I don't think that I can emphasize that enough, just given, what I've seen, witnessed, and have also been subjected to, is that even if Harvest of the Month is currently being implemented, we know that this is a drop in the bucket, and we don't want to stop here. We want to continue. We want to expand. There are other institutions that is technically under CDCR that are not currently participating in the program, like alternative custody programs. And so really looking at measures in which we can reach as many people as possible to really make the most impact is really going to help push the needle just ever so slightly further.
Thank you. And in public health, we talk about spread and scale a lot in terms of successful programming. And I hear you saying inform, spread, and scale, right? We need to consider who we're scaling for and what their needs are. Thank you. And along those lines, let's go back to Krista. What do you want this audience to understand most clearly about incarcerated people's nutrition needs during pregnancy?
First, that we need to treat nutrition as healthcare. And just because you are incarcerated does not mean, as was mentioned earlier, that punishment is that for you not to receive a snack, a fruit, a vegetable, a protein shake, whatever it is, right? And I think that we have to have these conversations. So thank you again, Diane, for this conversation, because we need to bring more recognition to it. And then we need to be transparent, and there needs to be accountability. There needs to be regular audits of the food and the quality of the food in these facilities. Also, they need to report, what are they serving, right? Like, it was so hard for me to find out what the menu was for the pregnancy pod, just to kind of know what they're being fed, right? Because if we do have a person who is lactating, she needs additional nourishment as well as hydration, right? So when the water cooler doesn't have any water, and the guard just didn't feel like filling it before his shift was over, does that mean they don't have water that evening? Absolutely not. So these are just simple, basic things that I think are overlooked. And as we continue to have these conversations, but also talking about postpartum support, which is something that we're really looking at now, because a lot of our clients, when they get out, we're there to help them and support them. And then they just don't know what they don't know, right? So we're guiding them to these other community resources and just making sure that they have this additional support that they need to parent, right? Because yeah, I had my baby while I was incarcerated. I haven't been with my baby for maybe 3 months to 3 years. And now when I come out, I'm a parent and I still need support. And we know that postpartum mental health, you can be suffering from postpartum depression up to 7 years after having a baby, right? So what does that continued support look like? So I just think that we just need to continue to be very accountable to each other. And then we need more funding. I mean, at the end of the day, like, we've got to fund these programs so that we can continue to do the work that we are all doing.
Thank you, Krista. And I'm going to wrap up our panel with one last question for everyone. Actually, I'm going to let you choose. Either give us a call to action or tell us what gives you hope. And I'm going to start with Ryan.
I'm gonna go with the call to action because I love the things being said here, and I think everyone has an opportunity to really make change. And I will say, build collaborative relationships. There's a legitimate reason to give criticism and to absolutely tell the truth. But going back to Hyla's point, what gets measured gets managed, but I like to say what gets measured gets improved. And so build collaborative relationships, get in there and have conversations, and don't be afraid. There's nothing that is a showstopper in any respect of this. We all believe in this stuff. We are willing to put our tax dollars behind it. There should be funding for these issues. And with the right collaboration and partnerships, there's nothing stopping improving every aspect of this system. And so really just take up the baton and get together with people and really create an opportunity to go and make that change.
Thanks, Ryan. We have so many questions from the audience. Thank you. I think we could spend another hour, and they're really good questions too. So thank you, audience, for sending in questions to everyone. I'm going to transition over to the Q&A now. Lexi, you can open back up the chat if it was closed, and folks, let us know what struck you about today's conversation, anything you might do differently, or next steps for you. And while you're doing that in the chat, I'm gonna pull up our first question, and I will open this to anyone on the panel who feels like they can answer it. How can correction staff be better engaged or trained to understand nutrition as a health and safety issue rather than just a compliance task?
I can try to take that one. Aishatu, I saw you come off if you want to jump in, but um, I think it goes back to that collaboration. I think it goes back to giving people a true understanding of what it's doing. And Hyla gave a great example of how it can really permeate throughout a system, which is starting in a kind of a pilot space. So I'll use rehabilitation in general as the probably the greatest example here is people that work in rehabilitation are vying to get in there. They see happier people. They see more participation. There's less issues. And so finding space to see that transform change will permeate throughout the system. And that would be, I think, something that I think really helps correctional officers and spending the time and resources to do that. We had something called cross training where we literally were sitting together with the population and the custody officers talking about how this improves their lives. And you see well-being go up across the board for both people that are incarcerated and people working there. And so I think really giving the opportunity to show that change can really make that change, but it also is a top-down approach. Executives have to be on board and executives have to be willing to push those changes.
Thanks, Ryan. And that reminds me so much of what Aishatu you shared about the need for narrative shift and how that really drives your work. Is there anything you want to add to that? No, you're good? Okay. All right. So the next
Can I add
question.
something to that, Diane?
Oh, yes, please. Go ahead,
Sorry.
Hyla.
So another part of our work, we actually conduct nutrition education workshops. It's targeted mainly for people in reentry and for the communities that they come home to. But we've been having conversations around our desires to share this education with correctional staff, right? Like we oftentimes partner with folks who are directly working in food service, but there is a bit of a disconnect when it comes to custody. And so where there is a gap in all of this is, the belief and assumptions versus the reality. The reality is that the incarcerated people really they crave fruits and vegetables and fresh, healthy, nutritious items. The belief or the attitudes around that are extremely different when it comes to our conversations with custody staff. And so I think that having these trauma-informed nutrition education sessions and workshops specifically for the staff, can really help develop a sense of empathy and understanding and can even change the culture, like Ryan was talking about, right? There is a culture there where it's all about compliance with policy. The staff is responsible for delivering a tray or giving a tray, but even the manner in which it's delivered can make a whole world of a difference. Speaking from experience in county, I was given a tray on the floor versus, another institution when you're given a tray through a slot. Now, it's not the best way, not the most humane way, but there is still like a night and day type of difference in that. Now, what if we took it to handing a person a tray? It dignifies that experience, right? And I think that those are just very little changes that don't require much input, much resources, but all it requires is just a little bit of care and a little bit of concern that can just change the overall morale inside of an institution. And with that, the ripple effects can be huge in terms of safety and security, right? When the walls are no longer up, then the guards, the internal guards, and like the sense of, threat and violence can also find its way to come down to.
I love what Heile said. The piece that I'll also add, and Heile, thank you so much for sharing that, is I often also want to invite the prison administration and nonprofits that are working in there to actually bring the staff in as a part of the conversation. If you're having conversations on bringing in healthy fruit into the prison for the people in prison, also have that offering for the people that are working inside of the prison. A big way that we think about this is there's always an us versus them in this conversation, and that exists for a lot of reasons. But one way that we can think about intervention is bringing them along. If you're having, pineapples inside of the prison for the people, have that also for the staff. If you're thinking about having salad day inside of the prison for the individual incarcerated, also have a piece of that for the staff as well. And I think that also allows people to feel seen in the prison, and that what Heile says releases some of their actual internal guard down and allows them to see individuals as support.
Thank you. Thank you. Thank you both. The next question I have is a very nuts and bolts kind of question. Can eligible pregnant women in prisons access WIC food benefits? Krista?
So to my knowledge, and here in Ohio, the birthing incarcerated person does not have access to WIC. However, whoever has the baby, so the family members who have the baby, they will receive the WIC benefits and receive all of the, support in that way. But one of the things that we've been really, really good about doing is making sure that when the medical staff is there with the doula, that they write it into their charts so that if they need additional, okay, we need protein shakes, you need fruit, vegetables, whatever it is they need additionally, that they're able to receive that. I can't promise that it happens every day, but that is something that we do try to do. But one of the reasons I actually put on here as when they get out, why not give them WIC benefits? Why not allow them to be able to receive the WIC for themselves? Because we're still in this postpartum period where nutrition and hydration are just as important as when I was pregnant. So I absolutely think that this is a great question and something that I'm actually going to ask the warden about, just to kind of see if they would be able to receive WIC benefits while they are incarcerated.
Fantastic. Thank you. And thank you for that question that came. Let's see. We also have some questions. I know, Krista, you mentioned your doula client who was able to continue pumping. Do prisons typically have access to breast pumps? And there's someone posted a question with a lot of mini questions. So I'm gonna throw all of those questions out there, and we'll see if we can get to all of them. So how can we improve breastfeeding rates for incarcerated women? Access to breast pumps. Are inmates protected under the Pump Act? And do they have access to a fridge or freezer to store their breast milk regularly? So Krista, we'll start with you, but Heile, Aishatu, Ryan, please jump in also.
Okay. Yes, and yes, super yes. So here's the thing. So on the pregnancy pod, there is a special refrigerator, there is a freezer there, everything is separate. There is even a lactation room. Now, is it what we would think of? It is a room where a person could go in for privacy to pump. Our doula makes sure that every single birthing person who wants to continue to pump, they do have a breast pump by the time they leave the hospital. So once they leave, they're in their bags and all of that. They do have access to breast pumps and then hand pumps as well. So they do have all of that. Here's the thing. In order to do that, our doula, she's so lovely. She makes sure that they have a picture of baby. So we know that when you look at the baby, it's going to allow the milk to let down more. And so we do offer lactation support classes and education for our birthing persons who are incarcerated who want to breastfeed. And when she goes in, she will talk to them or whatever support they need to make sure that they're still interested in pumping. Are you getting enough water? Is there anything else that you need? So they do receive that additional support when she goes in there.
It's great to hear that. So we've got a picture of one place in Cleveland. Um, Heile, Aishatu, Ryan, do you have any insight into how breastfeeding and supporting lactation is in California? No?
I'll be honest, I've never heard of any support for breastfeeding in California.
Yeah, I am in the same place. An interesting conversation on Krista is motivating me to make some phone calls after this for sure, though. Start getting that conversation started.
All
Same.
right.
Same.
Like, oh,
In the same boat. I think it's also important. I appreciate the question is that a state prison is a state prison, which means each state prison is run slightly differently, and jails are run a different system, and detention facilities are run on a different system. So it could very well be in California that this all exists in one of those systems or in other states as well. So I loved hearing what's happening where you are, Krista, but also to answer the question for the individual, I don't know, and it's hard to know what's happening in every single state. That's when it's not a federal regulation.
Thanks, everybody. And it sounds like there's more work to do, maybe even together. We have a question in the chat about the quality of food in ICE detention facilities, and I know that's not exactly the same as incarceration. Does anyone have any thoughts about that they'd like to share? Okay. That might be a topic for another webinar, but I want to thank everybody thank Jolene for putting that question in. We have so many comments about people really appreciating the conversation today. So thank you to our panel. This has just really been fantastic. We heard about how to develop partnerships, first steps, we heard about conditions on the ground. We heard about lactation support in Cleveland and doula support. And I know that I learned so much putting this webinar together with you and even from your answers today. So thank you so much, Aishatu, Heile, Krista, and Ryan. We're so grateful that you joined us. For folks who are in the audience, let us know in the chat, is there one thing you're going to do this week because of what you learned today? Any follow-ups you want us to know about that we can kind of maybe check back in with you or send you in a message? Let us know how this impacted you. And I want to ask everybody to please join us on Wednesday, June 17th. It feels like a long way away. But you can save the date and register for our next webinar at impacthunger.org. When we close out the webinar, a survey is going to pop up, and we really appreciate your feedback. Some of the feedback that we got informed that we should go to longer sessions like this, which allow us to have much deeper conversations. So I know everybody's got to go to the bathroom, walk the dog, feed the kid, all of the things. If you can take a minute and do the survey, we really do appreciate it, and we read every single response. So with that, let me ask each of the panelists, we've put some resources in the chat. Is there any last word you want to leave anyone with?
I'll choose one. No, it isn't the last one. At Impact Justice, we often talk about the fact that we would just want everyone to do something. I think once you learn about a topic, you learn about an issue, do something. If that means read something to learn more and share with somebody, if that means write a letter to your policymaker, that means make a phone call and tell a friend about what you learned to get together, just do something. And every time you do something, it makes a difference as we continue to move and change the work that we're doing. So please leave this conversation and do something.
All right, with that, we're going to close things up. I hope to see all of you in June. We will send you a recording. If you register for the webinar, you have my email. So reach out if you have any questions or anything specific that you'd like to connect about. All right, Lexi, we can go ahead and close everything down. Have a wonderful day, everyone.